Welcome to Facebook Live. I'm Joanne Conroy, and President and CEO of Dartmouth-Hitchcock, Dartmouth-Hitchcock Health. And I'm trying to figure out what camera I want to look at. I'll look at this one here. So, only a week until election. And this may be one of the most important decisions that voters make across the country. In preparation for that, we've got our experts on our government relations team to spend some time with us and talk a little bit about what they do. And I think it's just context setting for how important it is for people to exercise their right to vote and have their voices heard. So my first guest is Matthew Hood, who's Vice President of Government Relations. And after Matt and I talk for a while, then we're going to bring in Allison McDonald, who's in DC, who's our VP of Federal Policy and Affairs. And let me start with Matt. Now, Matt, tell us a little bit about your history. I have to be honest, I know Matt's mom was a midwife that started the midwife program here. And if you haven't seen Call the Midwife, there are 10 seasons, so it'll keep you busy through most of November and December. It's an incredible insight into the life of a midwife. But talk a little bit about your mom and how you really got introduced to Dartmouth-Hitchcock, which was as really a young kid.
Sure, thanks, Joanne. Right, I've been with Dartmouth-Hitchcock in government relations for 9 years this month, but certainly familiar with Dartmouth-Hitchcock a lot longer than that. So we moved to Hanover in 1983 when my mom started the midwifery program. It's funny because while I went on to Dartmouth College, and while I was at the college, lots of people want to go away because they've been here for a long time. We've only been there for 4 years in high school. And then I remember walking across the green, and in 4 years I saw my mom once, unintentionally, just kind of happened because she would walk from home to work every day. And fortunately, they had those colored stripes of tape on the floor of the old hospital, so I just follow a path to OBGYN when I was coming to visit her when I was in high school. So it's a long connection, actually, now that I think about it.
Yeah. Well, she probably delivered a lot of people that still live in the Upper Valley.
Indeed.
Yeah. So I know you haven't seen the series yet, but it brings back a lot of memories, I think, for you and your family.
Right. Thank you. Well, it's actually always really a wonderful reminder from my mom who's passed when people say that she was their midwife, and it's just such a strong connection. So my mom kind of set the path for my large footsteps to follow, but yeah.
So Dartmouth College to government relations, how did you make that jump? What attracted you to that field?
So not having the science inclination that my mom did, I gravitated more towards government and policy, as many do in that situation.
Did Dartmouth have pretty good government and policy people back then?
Yeah, they still do. But I went to law school and practiced corporate law for a while, and then while I was practicing, I was exposed to healthcare law, which interested me. Still gravitated more towards the policy, and so after some twists and turns, and I'll make a long story short, I ended up serving in the New Hampshire legislature. Not coincidentally, perhaps after my mom had served in the legislature, and so I had done that for 3 terms. At the end of my time in Concord, an opportunity came up at Dartmouth-Hitchcock that was kind of combining all of those things, policy, healthcare, and law. And I thought it would be a great way to combine it, and it's turned out to be that way.
Yeah. Did you and your mom ever get to talk about your experience in the state legislature?
Every once in a while we'd commute to Concord together. So I was in the Senate when she was in the House, and we would have that opportunity, and some good stories from that.
What were the issues that she was really passionate about?
Well, as you can imagine, she was really concerned about women's health care and equity issues. The first that I got exposed to it was, for my personal kind of foray, was when there was actually a bill to legislate a constitutional amendment precluding same-sex marriage in the state of New Hampshire. And that was too much, and I had to go and engage and testify against that as a citizen. She was in the legislature at that point in time, and she was a spirited advocate and a really wonderful person to reach across party lines. So literally, when we were in the at her service, there were as many Republican representatives in the church as there were Democratic ones. So
yeah, that's a wonderful.
She set a nice model.
Yeah. You know, it's interesting, some of the challenges that people are dealing with now on women's health and equity, specifically around stories like Serena Williams and Beyonce, that they really had a hard time getting care, being attended to in the way that they expected, according to the problems they were experiencing. Probably makes her concerns just as relevant today as they were 20 years ago.
Absolutely. I mean, I think while it may have been the forefront of some of those conversation pieces, I mean, starting the midwifery program, wonderful stories about when she was at Yale New Haven before and when she went into a room of OB docs who were all men, and the dean was questioning why there was a woman in the midst. They resonate today, without a doubt. Yeah. So some struggles continue, I think.
Yeah. So every year, you and your team establish priorities for state legislation. And there's a ton of legislation at a state level that has to do with healthcare. Right. It's probably a third of the things that move forward have to do with healthcare. So it's pretty important to understand what's emerging and to identify your priorities. How do you go about doing that?
So throughout the course of the year, we'll solicit and we'll get outreach from providers and administrators and stakeholders about issues that they're facing, issues that they'd like to advance or obstacles that they'd like to remove. And so we'll work with them on those, which adds to kind of our priority bucket. And I would say our priority bucket falls into the 4 R's: reimbursement, reform, regulation, and research. And so with respect to reimbursement, we advocate for sustainable reimbursement from public payers. It's obviously a challenge with respect to fiscal constraints on the federal and state level.
Right.
With respect to reform, we advocate for health policy that advances care for our patients, our providers in the system, and against those that would create barriers for our patients, providers and system. And then in terms of regulation, think about all of the regulatory space that affects healthcare.
Yeah.
And whether it's HHS or Department of Insurance, et cetera, throughout the course of the year, regulations are promulgated to fill in the outlines of law. We're an academic medical research center, so research is an important component. Allison may speak to that because it's largely federally funded. But so those are the kind of buckets that we think about when we think about our priorities. We add to them with conversations that we have with providers throughout the course of the year. And then we literally say, okay, what's our affirmative agenda? And we line up stakeholders and we talk to legislators and policymakers. And then there's this reactive part. So in New Hampshire and Vermont, they meet from January to June. It's a citizen legislature. They're large bodies. In New Hampshire, there are 400 members of the House of Representatives. Over 1,000 bills a year pretty much are introduced. A third of which deal with healthcare. And so we play a lot of defense too in that space. I don't know that I have a lot of time for tactics in the advocacy space, but one of the things we do is we make sure that we're engaging with policymakers, that we're putting subject matter experts in front of them because they want to hear from them and how it would impact their daily life and care that's provided to patients.
So really, when you decide there's an issue that needs greater attention, or we want to kind of shift the focus on the issue, the process is you identify people that you really want to connect with. You and Courtney, who is a director in the office, actually start engaging with the legislators at the State House or like on their home turf?
So great question. So and I'm glad that you mentioned Courtney. So Courtney is literally used to spend all of her time in the halls of Concord. So talking to policymakers, talking to stakeholders. Then all of a sudden COVID hit and everything went virtual. One of the examples of legislation that was really rewarding to work on was the telehealth progress that was made. And so it's kind of an example of teamwork with our team, but also with the subject matter experts. So we worked with Mary Lowry and Kevin Curtis in the Connected Care Center on pieces of telehealth legislation, whether it's in the substance use disorder space or behavioral health, over sessions and making incremental progress, but incremental. And then all of a sudden COVID came, and people, policymakers included, really discovered the value of being connected to their patients and having providers be able to connect to their patients, including telephonically,
Yep.
when they couldn't go into to the hospital because the hospitals were preparing for a surge. So there was really dramatic progress in that space.
Yeah, I do remember. It was a heavy lift. There were maybe more so in Vermont than in New Hampshire, but you still had to kind of make sure that both states appreciated the importance of allowing us to deliver care on both sides of the river and allowing us to deliver care in a very different way.
Yeah, well, and thank you for your engagement in that space. There were several conversations with HHS and
Yeah.
the governor's office about making sure that licensure issues would be resolved so that our providers licensed in New Hampshire could care for the patients in Vermont.
In Vermont.
Yeah.
A couple questions though about interacting with state legislators. So if there are no halls to wander through, it's pretty easy for a legislator to avoid having conversations by just not agreeing to a Zoom meeting. So, but if Courtney was walking down the hallway, I mean, they'd have to duck into a men's or a ladies' room to avoid her.
I think Courtney's still pretty persistent, so tracks them down either by phone or computer or otherwise. Really, when we pivoted, it was much harder to have sessions that people could plug into,
Yeah.
the public could plug into, which I think both New Hampshire and Vermont kind of navigated as they went. Largely in New Hampshire, the legislature shut down from March until May, I think, before they reconvened. So no, there was a lot of activity right as soon as they reconvened to the close of session in June, where a lot needed to move, and Courtney was absolutely plugged into that space.
Yeah, good. Yeah. I'm only thinking you must spend 12 hours on Zoom every day. So.
If I don't have another Zoom, I'll be okay for a little while, yeah, without a doubt.
Now, I do want to remind our Facebook viewers that you can ask questions in the Facebook post feed, and they will magically appear here on my iPad, so I'll be able to introduce them into the conversation. All right, well, joining me now, remote from DC, is Allison McDonald, Vice President of Federal Policy and Affairs.
Hi, Joanne.
Hey, Allison. My assumption is that everybody can see you, so. We were just talking before we came on the phone about how DC has changed. Certainly Concord has changed, and we have the virtual halls that we're wandering through. What's it like in DC?
Well, I would say, generally at this time of year, within a week before election, members of Congress are back at home in their home districts campaigning. The House has recessed, the Senate remains for a Supreme Court nominee. And so in general, we have members in town where we generally haven't at this point of year in a campaign cycle. The city, as a result of the COVID, has shut down. Many people are working from home as they are across the country. And Capitol Hill is actually, members are in their offices. Some of their staff are working from home and remote, but public visitors are not currently going in. So it is not business as usual as a result of the pandemic down here.
So do you actually have those important conversations with your colleagues, other people that work on the Hill, as well as our legislative delegation? Do you do that all through Zoom?
It is all through Zoom at this point, and phone and email.
Yeah. So life is actually very different, and it will probably be different for the next 9 months at best. Mm-hmm. So anyway, we're all getting very good at Zoom and have a kind of a capacity to create relationships in really strange and different ways. So let's talk about the policies and the regulations that affect DHH at congressional and at the Senate level. Can you talk a little bit about the things that you've been working on and how you integrated those conversations with our subject matter experts, and what do we have what do we have to look forward to in the future?
Well, I think a couple thoughts. In the future, obviously, the election next week will impact what priorities move forward in the beginning of the 2021 legislative session and the administrative work in the White House, pending who's in the White House and who's in control of the House and the Senate. I would say, Joanne, to the previous conversation, is that the move to remote has really enabled us to bring some of our experts, frontline healthcare experts and policy experts, to the delegation and to HHS, the federal HHS, in ways that we hadn't been able to be before. In the telehealth space, as Matthew alluded to, they've been working very hard on telehealth at the state level. We've also been doing a lot on the telehealth space in the federal level. We've been able to have our experts participate in roundtables with both Senator Shaheen and Senator Hassan. We also, as you know, you participated in a coalition event with the Bipartisan Policy Center talking about telehealth in the rural areas and rural regions of the country. And we have been able to do that all remotely. Similarly, there's opportunities in the telehealth space that we've taken in the regulatory arena. The physician fee schedule this year included a lot of questions for stakeholder comment on telehealth. And so we were able to provide a written platform on comment on the impact of telehealth in our region and to Dartmouth-Hitchcock Health.
People probably don't appreciate how critical it is in a rural geography that we deliver care to actually continue to have telehealth. Now, I know some of the commercial insurers were put limits on how long they would pay for telehealth. What's the conversation at a national level about whether or not there needs to be an intervention for those that don't actually see the value of it? Or have they all figured out that it's actually a really valuable, high quality, lower cost way to deliver care?
So under the, currently we at the federal government are operating under both a national emergency as well as a public health emergency. That has enabled some waivers and flexibilities to be issued via the administration and CMS. That has allowed for telehealth to be reimbursable and other flexibilities for Medicare patients during this public health emergency. Of course, the question is, once the public health emergency is no longer in place, how long will those, or what will happen to those flexibilities? And current conversations are ongoing at the regulatory space with CMS and HHS, as well as on Capitol Hill for statutory changes that might make some of these issues permanent. I'd say that it's actually gaining some bipartisan support. Republican-led Senate in the Help Committee had a hearing in which a number of Republican and Democratic offices offered their support and encouragement on long-term telehealth changes.
So one question about how the hearings are held. Are the senators or the congressmen and women, are they in rooms or are they in Zoom rooms?
It depends committee by committee, and it's over the last 8 months of the pandemic, it's also changed a bit. Members, there have been all virtual hearings, and also, as we've seen in the Supreme Court nomination hearings that happened over the last 2 weeks, some folks are there in person and some folks are Zooming into the hearings themselves.
Okay. Now, Allison, tell the Facebook Live viewers a little bit about yourself. You are from New Hampshire, and you worked for Senator Shaheen for a long time before you decided to come to work for us. Is that correct?
That's right. I'm a very proud Granite Stater. I grew up in the Mount Washington Valley in Conway, New Hampshire. And I've been in Washington, D.C. for about 20 years now. I've worked for Dartmouth-Hitchcock for the last 4, and previous to that, I worked for Senator Shaheen on Capitol Hill.
Is there anything you miss about being a staffer for a U.S. senator And what are the things that you don't miss about it?
It's a very rewarding position to be in. It's an opportunity to learn a lot and have access to a lot of experts to help form the conversation at the national level. It is really, really in any office, the more you work, you are introduced to a whole number of issues, and you get an opportunity to interact with a whole lot of people with varying opinions and ideas, and it's fantastic. It is hard work, it is long hours, and the schedule is obviously at the whim of the majority leader, or in the case, often. So it's a bit unpredictable, but it's also what makes it incredibly invigorating and fun.
So a question for both of you. November 3rd, we vote. Hard to say when we'll have the results of the election, but most of us expect that it will be kind of an orderly process and mail-in ballots will be counted, even though there's an incredible number of early voting and mail-in voting that's occurring. So when do you start planning, and how do you plan together? What are your top priorities? Because there could be a lot of shifting if the Senate shifts, if the White House shifts, if Congress shifts, which is unlikely, but all of a sudden that could really change the things that you think we need to start thinking about and working on. So Matt and Allison, what's going to happen November 5th, 6th, 7th, 8th, 9th, and 10th for you?
So Allison, you want to field that one to start on the federal level, and then we'll bring it down to the state level?
Sure. So, at the federal level, we still need to wrap up the current legislative session. So there'll be a lame duck session that goes on in late November, early December. The Congress needs to act on appropriations for federal funding and a number of other policies that are sort of wrapped up in that, with some sunsets, some deadlines. So we'll have some work to do before we really begin to look at the 2021 legislative sessions. And as you point out, Joanne, there'll be a lot of thought given to what we will try to push forward in an offensive measure and what we may need to be reactive to. Clearly, we will look at all of the policies as far as what is best for our patients, for our providers, for our community, and we'll work in concert with a number at the federal level, and Matthew can comment at the state level, but we'll work in concert with a number of coalitions and other folks and providers that may share similar interests and priorities as we do.
Matt?
So many thoughts. First is a bad prognosticator, so you're not asking me to say which
no,
we're going to end
up
on.
I am not asking you which.
November 3rd or whenever we find out. My sense is it'll be easier to determine who wins on the state level in New Hampshire and Vermont. It's just not going to be as complicated. Yep. And the window of time for legislators newly elected, to join their incumbents in filing bills will open. And so there will be a flood of bills that lead us, that we spend time from Thanksgiving to New Year making sure we have our hands around. That's significantly what will happen, at least in New Hampshire and Vermont. And then Allison and I think, understand that there are, where there's overlap is what are the opportunities for us depending upon the administration and the composition of Congress, and what are the things that we'll need to continue to watch.
Yeah. Now, for decades, we have been promoting We Care, We Vote, which is a nonpartisan voter education initiative focused on our employees. Can you tell me why this initiative was started and what it involves?
Sorry, I'm not sure if Allison
You can't tell that he's looking at you, Allison.
Right, sorry.
I'm happy to take it. Care We Vote is actually an initiative that the American Hospital Association has launched, and we've taken it and run with it in our own Dartmouth-Hitchcock way. It is a program to educate and empower our employees to give them the tools they need to register to vote, to learn about the issues, and to cast their vote. Clearly, voting this year is a little bit different with the pandemic. There's lots of different opportunities and ways, mail-in and absentee voting for folks that may not want to go in person. So our goal this year, we have a website that's created, and employees can go and learn about how to register to vote. We have resources on different questions you might want to consider asking the candidates. And we've also engaged in a series of health policy ground rounds. We've invited all candidates that are running for federal or state office to Dartmouth-Hitchcock to participate in a virtual grand rounds in which employees can ask questions of them at that time. We've recorded those, and they're available also on the We Care, We Vote website.
And I would just add that we've had terrific success in terms of the candidates, both incumbents and those who are challenging for those positions, joining us this session. So it's been a good showing, I think.
Yeah, maybe something we should continue if it's so much easier to get them here on Zoom. I have noticed that my calendar is filled this week with people involved in the election process. This is a question from one of our viewers. The presidential election cycle seems to get most of the attention. And it is interesting, as an aside, my group Women of Impact, we invited Rachel Beithofer, who is one of the 3 people that accurately predicted the midterm elections in 2018 down to the seat. And she, it's interesting, she talked about some of the facts and figures about presidential elections versus midterm elections, but there is far more focus on the presidential election, when in reality, most of our lives are affected by what goes on in our state. Can you talk about the importance of the state contests and how important it is to get the vote out?
So while there are areas where Allison and my work and Courtney and my work and Allison's overlap, right, between state issues and federal issues, whether it's telehealth and Medicare provisions and flexibilities, or state flexibilities, and lots of issues are state regulated. So whether it's licensure, scope of practice is largely a state issue. People's lives in terms of funding of public health services, the feds do allocate a lot of dollars, but they're impacted how they flow through the state.
Yeah.
And so it also feels more intimate in many occasions on the state level, because you can run into your candidate or your representative in the co-op, even if they can hide more easily in a time of COVID.
They can't hide in the co-op, though. We'll find them.
Right. And I should say that our delegation is exceedingly accessible, and the relationships that we have with them are very strong. But you feel an impact from a state action very quickly, and regulations that, again, HHS might promulgate are ones that are literally going to affect Dartmouth-Hitchcock health on a daily basis. And so we need to be engaged in that space, certainly. And you get a chance every 2 years in New Hampshire and Vermont, because every office holder has it for 2 years. So.
Yeah. You know, it is, both New Hampshire and Vermont are really unique states in that you actually do see your representatives out in the community, and you have many opportunities to kind of share with them your views and really educate them about the things that are important to us. Here's another question. Other than voting, what one action could someone take to get more involved in local, regional, and national politics to help make a difference in their communities? Well, we know we have so many people elected to the State House in New Hampshire that you could run for office.
Absolutely.
But short of that, how do other people get involved?
Well, so the Speaker of the House literally said on inauguration 14 years ago or whatever, if you live long enough in New Hampshire, you'll serve in the New Hampshire House, and that's absolutely true, and people should not feel daunted by that process. I'm actually going to borrow from something that Representative Welch said when talking about a related topic about discourse and civil discourse, and he said act locally. and I think it's really good advice. So it's tangible, it's in your community, you can affect change, you can get engaged in the it might overlap with the political process, but I think that's a sound advice.
Yeah. Any additions, Allison, to that?
Well, I think very sage advice, Matthew. Thank you. I think the only thing I would add is that for our employees or of Dartmouth-Hitchcock that may be watching, there's lots of opportunities to influence policy and maybe politics in general through professional societies and trade groups that folks may be members of. And so while we think about voting and engagement in that citizen as a citizen, there may be things that folks can do in a professional capacity to change policies that may impact their everyday work life as well. And that can be through both state and national chapters of trade groups and professional societies.
Yep. Good advice. You know what? I don't think Americans fully appreciate what a privilege it is to be able to vote. And I think people from other countries probably appreciate the privilege even more than we do, because there are many societies across the world where people don't have the opportunity to have their voice heard. And when you think about it, people fought for years for representation. And it is really everybody's responsibility to have their voice heard and go vote, have a plan to vote on November 3rd. So you can participate in a uniquely American process. I want to thank you, Allison, and thank you, Matt. Please remember, your vote matters now more than ever on November 3rd. So exercise your right, have your voice heard. Thank you for joining us.